This is the online video tutorial for Fotona UK and Ireland. It is used to complement the hands-on manufacturer training in conjunction with the Fotona training booklet. This is aimed to be a refresher and cannot be used as an alternative to the hands-on manufacturer training supplied by Fotona UK and Ireland. To start your acne treatment protocol, you'll be going to NDYAG and selecting Active Acne. So depending on your patient and their skin condition, you can select Active Acne or an anti-inflammation setting. So for example, I'm going to select Active Acne. Selecting whether your patient is male or female will adjust the settings, and you're also selecting their skin type. The R33 is what we'll be using today, and when you're happy, tick, and it will move you onto your settings screen. So we would advise that you work between 35 and 40 joules. The milliseconds is already preset to 25, and the spot size you'll be using is a spot size 4. For the first part of the treatment, we would recommend, if there are any spots, you can actually take the hertz down, take that speed right down, and work in a spiraling motion around those spots, keeping all of the other settings the same. Once you have concentrated on these areas, you can, again, keeping the settings the same, increase your speed back up and apply over the full face. Speed-wise, I would go between 4 and 6 hertz, but really do whatever you feel comfortable. So for the full face treatment, that's ready to go. For step 1 of the acne protocol, we're going to be focusing on individual spots, followed by working on the whole face to reduce down any excess sebum that there might be and help to shrink down the sebaceous glands. And luckily for this patient, we have very little in the way of spots, but I will demonstrate just in a small area here the spiraling technique that you need to use. So taking the speed quite low to about 1 to 1.5 hertz, you're going to be concentrating around the individual spots, working from the outside into the centre. You'll want very high cool air to maintain comfort for the patient. So you can see here that I'm going to slowly spiral around the spot, finishing in the centre. This can be a little bit tender for patients. Here we go again. And it's as simple as that. So you'll be looking at doing about 4 to 5 passes around the spot, or whatever the patient can tolerate. Once you've worked on all of the individual spots, you can now up your speed to anywhere between 5 and 7 hertz to apply this across the whole face in a fast sweeping motion, like so. As is always the case with NDYAG, we don't want any snapping or stopping. We just need a nice, fast, flowing movement over the skin. You can really focus this in areas of congestion and also the T-zone area, which is very commonplace for excess oil. Get my patient to turn their head slightly and just working around the nose area there. The chin area and also on the forehead. Finishing on the other side of the face. You're looking to do this for about 9 9 to 12 minutes before starting step 2. Following the active acne step, as per the protocol, we are going to borrow 2 steps from our 4D facelift protocol. So again, we're going to find Twin Light, Fotona 4D, and we're going to be using the FRAC 3 rejuvenation step, and we're going to be using the ultralight peel step. We're going to go to our FRAC 3 rejuvenation. This is using the R33 handpiece on a 4mm spot. So I have attached that ready to go. When we're happy, ticking there, and again our presets are open to change. I would keep it at 35 joules. Check in on the patient, make sure their tolerance is good. You can up the speed as well to between 5 and 7 hertz, and as you can see, the 4mm spot is there and ready. The pulse duration can be altered, but I would stick to 1.6 initially and amend later if you need to. But as it stands, this is good to go. We're off. You'll now be incorporating the FRAC 3 skin rejuvenation step from your 4D facelift protocol. This is going to help with background redness, any background pigmentation, and also inflammation that may be present too. So the same sweeping motion as before. So go with again nice high levels of cool air over the full face. If you can, you'll be doing this for, again, 9 to 12 minutes. So our fourth and final Fotona 4D step is the ultralight peel. So tap on there and you're looking for the PSO3X. We've already got that attached. What we're going to do now is put the little metal adapter on the end. So just a little bit of force and a slight twist, and that's secure. We're setting it to 7mm spot size. When you're ready to go, tick, and it will move you on to your settings screen. Now, we want 7mm. You can adjust your energy setting to what's appropriate for your patient and your speed as well. We'll be looking at taking that up to between 6 and 8 hertz. And then when you're happy, press this button. You will from time to time get this pop-up. This is just getting you to double check your settings, getting you to double check your handpiece and make sure everything is safe and ready to go. So we're selecting the 7mm, waiting for calibration, and there you are. So a really great way to finish off the acne treatment is to do the ultralight peel. This is great for helping to reduce visible pores, uneven skin texture, and just give the patient a really lovely healthy glow. So we're using our PSO3X, and again, energy-wise, you're going to be going anywhere between 1.8 joules up to about 2.4. Here we go. So looking for those little white dots to appear. So you can see those dead skin cells lifting away. Not moving too quickly and not leaving any gaps between the shots for nice even coverage. Once you've done the full face, you can then use a damp gauze to wipe away the skin cells, and you can repeat that process another 1 to 2 times. Please refer to the training booklet where you will have further information on treatment protocols and device presets.